Some of the issues that have come up in the past that have prevented patients from happily coming to see us as a profession have been linked to the fact of fear of the unknown. They weren't aware of what was going to happen to them because this wasn't really communicated to them in the past. Dentistry in the past, you went under duress to the dentist if you were in pain, and it usually wasn't a particularly pleasant experience. Through no fault of the dentist, I hasten to add, just the situation that you were in. Also, you had technology that wasn't advanced at the time, so often the treatment might have been painful, you had injections, and people had that intrinsic fear, which is quite natural. Minimum intervention dentistry in the patient in the modern era, things have changed a great deal. The crux of minimum intervention dentistry is the communication. It's the two-way approach to managing the care. And if we have to do minimally invasive keyhole sort of dentistry, we have the technology now to allow us to do that very effectively, with no real side effects, no real problems, and patients can come away smiling rather than come away in fear and trepidation. The days of using drills and big long needles and all this gas and air and all these classic things people always sort of think about in dentistry, those days are either gone or very much numbered. In my personal view, we shouldn't be calling the dentist a dental surgery anymore. It's not necessarily a surgery, and that conjures up a lot of perhaps negative issues. It should be an oral health clinic where patients go to have actually quite pleasant care. The minimum intervention message for today is to allow us to educate the children of today who are going to become the adults tomorrow, and to do that in such a way that they are intrinsically motivated and keen to want to go to the oral health clinic to maintain the health that they are striving for. I think now we can drive home at a very early age that youngsters can go along to their dentist, that they're friendly, they can go and see what's going on, that there's a whole team of people, and if they do all the basic things right, they can carry on right the way throughout their lives without ever having any even remotely unpleasant care.
In tough economic times, we all have to watch our budgets very carefully. With dentistry, this is one area where we know that we can control our budget and what our budget is likely to be in the future. And the secret to this is all around prevention. Because whichever way you think about it, as soon as you start to have a lot of dentistry done in your mouth, you start to have fillings or complex dentistry, then there's the cost of having that done, and there's the cost of having that serviced routinely. So the way for families to think about controlling the cost of their dentistry is to think about this concept of maintaining health. And this starts from the very youngest children, and if families can embrace this, then the family budget can be controlled as well.